Good morning, ma'am.
Good morning, ma'am.
Good afternoon.
Good
Okay,
afternoon.
are you ready? We
Yes,
can
ma'am.
start? Yes?
Yes, ma'am.
Okay, therefore let's start. Yeah. Today we are going to talk about mixed dystrophy. Yeah.
Yes, ma'am.
First of all, you have to remember that mixed dystrophy, yeah, they are characterized by accumulation of metabolic disturbance products of disturbed metabolism, intracellular and extracellular. Yeah, therefore it's mixed because we can see the position of these substances everywhere exactly. Yeah, and there are substances which can accumulate at the same time inside in the cell and in the extracellular space, in vascular wall and another location. Yeah. First of all, there are compound substances, exactly compound proteins. Yeah. And also this ability have minerals. Yeah. Minerals, calcium, kalium, salts, yeah, and another minerals, they are accumulated everywhere. It doesn't have some specific location. Yeah, it happens like as intracellular and at the same time extracellular. Okay, first of all, we have to talk about compound proteins. Yeah. We have to divide them on according to presence or absence of color. Yeah, therefore, specific part or just exactly, yeah, some kind of these compound proteins. There are proteins which exactly have color. If it has color, therefore in accumulation, if deposition happens, tissue, organs becomes the same color. Yeah. Therefore, protein which exactly has color is pigment. Yeah, and we can use term pigmentation. Yeah, according to mixed dystrophy, exactly according to accumulation of this pigment protein which has color. Pigmentation has the same color as pigment, this protein. Yeah. Pigment could be, we should divide in two groups. If you open, you did homework, yeah, mostly, most of you exactly have finished workbook, home task. And in the first page of your home task, you can see tables, yeah. There are classifications of exactly these substances which can be accumulated intra and extracellular at the same time, mixed variant of location we can see. Is it clear or not?
Clear, ma'am.
Yes, teacher.
Yes, ma'am.
Okay. And first of all, you can see the table about compound proteins. Yeah, these compound proteins exactly compound pigments. Yeah. We should divide according to origin. Is it is it exactly here? Is it from outside, from environment, or it is from inside, from internal, exactly, yeah, from inside. If it is from outside, it is exogenous pigment. Yeah, exogenous pigmentation we can see and we can make it even, yeah, in tattoo. If you want some picture in our skin, therefore, we use exogenous pigment substance with color and inject in the skin. Yeah. Endogenous pigmentation exactly develops because of metabolic disturbances in our organism. Substance appears inside, exactly forms inside an organism and accumulates. And according to origin, there are three kinds of endogenous. Now we are talking about endogenous pigment. Pigment from inside, which exactly form inside an organism. They can develop exactly, yeah, because of hemoglobin destroying, yeah. You know that hemoglobin, this exactly pigment has red color, yeah. And exactly it contains in erythrocyte, and just one pigment and just one red cell in our organism. Yeah, it is erythrocyte because it contains hemoglobin. And hemoglobin inside in erythrocytes, in alive erythrocytes. You know that there are two types of hemoglobin. Oxyhemoglobin and carboxyhemoglobin. Yeah, they have different color, and therefore, according to them, we can see we can identify different vessels. Yeah, arterial blood they contain, and it has bright red color because of presence of oxygen. And venous blood, which exactly, yeah, erythrocyte and are rich in carboxyhemoglobin, and carboxyhemoglobin has bluish color. Therefore, yeah, we can see these blue vessels. There are venous, exactly venous vessels, yeah. But if something happened, something wrong happened, yeah, with erythrocyte, and erythrocyte destroy, usually and normally, yeah, erythrocyte should live. And tell me please, how long exactly erythrocyte can live?
120 days.
Yeah, 120 days. After 120 days, yeah, exactly develops apoptosis, physiological death, yeah. And in this period, exactly, erythrocyte and the hemoglobin inside erythrocyte destroyed, yeah, and from it we can see normal hemoglobinogenous pigments. Yeah, it happens all time, every day, yeah, because our erythrocyte, yeah, should die today or tomorrow, it depends, and every day destroying of erythrocytes happen, and therefore presence of hemoglobinogenous pigment which are originated from hemoglobin, yeah, it could be normal, and therefore you have to know three normal physiological hemoglobinogenous pigment. It is hemosiderin, bilirubin, and one more.
Ferritin.
Hematoidin.
Ferritin.
Ma'am, ferritin.
Hematoidin
yes.
is hematoidin is pathological, maybe.
Yeah, it's pathological. Yeah. There are 6 at all as general, and just 3 we can see in healthy person. But in truth, porphyrin, but very little concentration. Yeah, normally we can see a few porphyrin in healthy person. Yeah, but in porphyria, disease. Yeah, in disease we can see too much porphyrin, and according to this situation, therefore we are talking about porphyrin as pathological pigment. Okay, therefore, normally we should, according to apoptosis and physiological destroying of erythrocyte, usually we can see 3 pigments: ferritin, bilirubin, and hemosiderin. Yeah, but if something wrong happens, yeah, and erythrocytes should destroy earlier, not in the end, yeah, for example, in 90th day, yeah, or 50th day, something happened, yeah, malaria parasite, for example, comes in the blood and destroy erythrocyte. And we can see too much, exactly, for example, hemosiderin in the end. Yeah, after a few weeks, we can see in the blood or in tissues too much hemosiderin because of it. Yeah, therefore, in this situation, we have to talk about hemosiderosis. Is it clear?
Yes, ma'am.
Yeah, and also you have to know 3 pathological hemoglobinogenous pigments. Usually we can see them just in pathology, only in pathological condition, yeah, in diseases. There are hematins, hematidine, and porphyrin.
Okay.
Is it clear? Yeah, you know it, I think. Yeah. It is about hemoglobinogenous pigment, but in general there are 3 kinds, yeah, according to origin: hemoglobinogenous pigments, lipidogenous pigments, and proteinogenous. Yeah,
Okay.
it depends which exactly from where it is originated. Yeah, hemoglobinogenous pigments originated from hemoglobin, from erythrocyte destroying. Lipidogenous pigment, they develop because of lipidous membrane, exactly, and lipid destroying, yeah, and they contain lipids. And the last one, proteinogenous or tyrosinogenous, because of destroying of tyrosine in melanocytes, exactly, it happens, yeah. Okay, therefore, first of all, we have to talk about hemoglobinogenous pigments which are originated from hemoglobin. Yeah, I have named 6. Yeah, and we should divide physiological and pathological. About physiological, yeah, bilirubin, hemosiderin, and ferritin. We can observe exactly increasing their concentration in diseases, in 3 diseases exactly, yeah, hemosiderosis, hemochromatosis, and jaundice. But jaundice, it isn't disease, it is pathological process and even clinical symptom. First of all, let's start from hemosiderosis. And hemochromatosis is very similar diseases. The main difference between, because both of them characterized by excessive amount of hemosiderin in tissues, and it happens everywhere. It is generalized hemosiderin, like hemosiderin accumulation. Yeah. If it is local, if just in some tissue, in one organ, we can see hemosiderin accumulation, it is hemosiderosis. Yeah. We should classify hemosiderosis according to spreading, according to where exactly can we find hemosiderin deposition. If it happens everywhere, it is general hemosiderosis, yeah? And if it develops just in one organ, it is localized, local hemosiderosis. They develop because of different mechanisms, exactly, yeah, but the main reason of every hemosiderosis, it is hemolysis. It is hemosiderosis develops because of hemolysis of erythrocytes every time, yeah, always. It exactly caused by hemolysis, yeah. But if hemolysis of erythrocytes develops inside in bloodstream, in blood vessels, yeah, we should identify the position of hemosiderin everywhere in all tissues and organs. Therefore, it will be general hemosiderosis. And extra, it means the name of this condition, yeah, which exactly leads to general hemosiderosis is intravascular hemolysis. Therefore, the direct cause of general hemosiderosis is intravascular hemolysis. Inside intravascular vessel hemolysis, destroying of erythrocytes. Is it clear?
Okay. Yes,
Yes,
ma'am.
ma'am.
Clear.
Okay. Very nice, because it's very quiet and I don't understand who I'm talking with. Okay, therefore, about local hemosiderosis, if it develops just in one organ or even in some pitches, for example, just in one part of the skin, yeah, it develops because of extravascular hemolysis. Yeah, it means that blood and erythrocytes exactly, yeah, go out from exactly the vessel, and outside of vessel in tissues, yeah, erythrocytes and hemoglobin in it is destroying, and from it hemosiderin is formed. Exactly, we can, as example of local hemosiderosis is bruise, yeah, hematoma. If, for example, if some trauma happens, yeah, and just once some part of vessel is destroyed, blood goes out from the vessel, hematoma, local blood accumulation in tissue happens, and yeah, do you remember, because exactly there are 4 stages of bruise coloration, and we can exactly divide, yeah. First of all, if trauma happens directly now, yeah, therefore which color in first phase of bruise development can we see? What color?
Pink.
Pink? Is it pink?
Red.
Ma'am,
Red.
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 Red color, yeah, dark red, yeah, red color because of blood, because of hemoglobin. Hemoglobin, and firstly it is oxyhemoglobin because it is oxygenated, yeah. Okay, therefore red color. Next, in the next day, after 2 days, what color should we see?
Dark
Blue
brown,
color.
ma'am.
Not brown, blue color. Why?
Due to
Cyanosis, ma'am. Due to hypoxia.
hemoglobin.
Carboxyhemoglobin, because oxygen from oxyhemoglobin is used, yeah? Tissues, exactly, yeah, will take this oxygen and instead carboxy will be connected. Yeah, therefore it becomes bluish because of carboxy hemoglobin accumulation. Okay, next color.
Yellow with
Brown.
green.
Green because of biliverdin accumulation, because hemoglobin destroy, and there are a lot of biochemical reaction, and one of them lead to biliverdin accumulation. And biliverdin, it doesn't contain ferrum and it has green color and gives green color exactly, yeah, in this place. Therefore, after a few days, we can see greenish color of the bruise, yeah. But have you seen sometimes that this bruise becomes like violet? Have you seen it or not?
Yes, of course.
Yes,
Yeah.
ma'am.
And how does it happen? How violet color exactly.
And due to mixing of oxyhemoglobin and carboxyhemoglobin,
Hello.
due to mixing of two colors.
Two colors. What two colors should we mix to exactly, yeah, to see violet color?
Red and
Yellow,
blue, ma'am.
blue and green.
Blue and red.
Red and blue.
Blue and green.
Red and blue. Yeah, red and blue. Yeah, it's correct. And how is it possible?
Ma'am, due to mixing of blood.
How is it possible? Therefore,
Maybe.
between, yeah, after first it is always red. Yeah, as next step after 1 day, it becomes blue color. Yeah, and after a few days, it should become a green color. But in the patient, we can see that after, for example, after blue color, it becomes violet color. How is it possible? We should mix this in the second phase. Yeah, we should mix blue color with red color. How is it possible? Additional trauma.
Mixing of oxyhemoglobin and
Yeah, but oxyhemoglobin can come from blood. How is it possible? New trauma, new blood vessel trauma injury, and oxyhemoglobin goes out from vessel, mix with carboxyhemoglobin, and we can see violet color. Is it clear?
Ma'am, I have just one question. So for getting violet color, you have to hit again at the old trauma point. So let's just say I have a trauma in my hand, and I have to hit that place again to get violet color.
We don't have to do it.
How would I get? Sorry for the
We
question.
don't have to do more trauma.
So how?
But yeah, but if patient, yeah, has one more trauma exactly in the same place, and new blood vessel is destroyed, and the hematoma is mixed because of appearance of new blood and oxyhemoglobin. Is it clear or not?
It's clear. Thank you.
Yes, but we shouldn't do it. Yeah,
Yes.
it isn't
Yes.
normal. Yeah, because patient should be very very polite according to this region. Yeah, don't do more trauma exactly. And the last point after biliverdin convertation exactly changing. Yeah, the last point, fourth, in the end of this bruise development, we can see yellowish brownish color. Yeah, because of hemosiderin. The hemosiderin, it is the last pigment which exactly forms because of through a lot of biochemical reaction, and it will be in the last stage of bruise development. Yeah, is it clear? It is the most stable pigment. And after a few times, this bruise becomes lighter, yellowish, and lighter. And in the end, it will disappear at all because macrophage exactly engulfs this hemosiderin. Is it clear?
Yes,
Yes,
teacher.
teacher.
Yes. Okay. General hemosiderosis, it is caused by intravascular hemolysis, and we can see hemosiderin accumulation everywhere in every organ and tissues. It happens because of something wrong happened in the blood, exactly in bloodstream. Therefore, usually we can see it. It can happen. It can develop. In infection diseases, for example, malaria, sepsis, in if we use another blood, in blood transfusion, but it was mistaken and we took another blood, not, for example, patient has second group, and RH, yeah, rhesus negative, but it was mistaken, and we use first blood minus, yeah, R minus. Therefore, it will be conflict inside in bloodstream between erythrocytes, yeah, and destroying of erythrocytes happens exactly in bloodstream. What else? Poisons, yeah, poisons, which exactly can come in organism, and exactly in bloodstream also this the poison can destroy erythrocyte. Leukemia. In leukemia also tumor cells are exactly blood cells. Yeah, and it's possible that destroying happens of all blood cells and especially erythrocytes. If mother, yeah, is for example, is negative, R negative, RH negative, and fetus is positive. Therefore, it should be between mother and child, the kid. It will be conflict, RH conflict, yeah, because this RH, it means protein in superficial erythrocyte membrane, yeah. In child, protein is present. In mother organism, it is absent. Immune system of mother's immune system, yeah, can see this protein and against this protein, RH, yeah, start to produce antibody, and antibodies exactly in the child organism start to destroy these erythrocytes. First of all, in these children in childbirth, exactly, yeah, we can see jaundice. And later, a little bit later, yeah, after a few days, weeks, it will be general hemosiderosis. Okay, about hemosiderosis, is it clear or not?
Yes, ma'am.
Yes. Okay, hemochromatosis, yeah. Morphologically, it's very similar to general hemosiderosis, because in hemochromatosis we also can see deposition, yeah, too much of hemosiderin. But also ferritin also should be accumulated, not too much. Predominantly it is hemosiderin accumulated in the everywhere, yeah. But the main difference between hemosiderosis and hemochromatosis, because they are very similar, yeah, it is exactly origin, which from where this hemosiderin appears. In hemosiderosis, it is from, tell me please, from where?
From erythrocyte.
From hemolysis, yeah, from destroying of erythrocytes, yeah. But in hemochromatosis, it develops because of excessive absorption of ferrum in the intestine. Is it clear?
Yes, ma'am.
Because ferrum is absorbed. Yes, some part of ferrum is exactly, it's formed because of physiological hemolysis. Yeah, and another half of ferrum, which exactly we need in, it is come from food, and it absorbed in the intestine. But if too much ferrum comes, yeah, exactly, absorbed, yeah, excessive absorption of the ferrum in the intestine lead to hemosiderin formation. From ferrum, yeah, will be formed ferrum containing pigment, and it is hemosiderin, and hemosiderin is accumulated in tissues everywhere. But the main clinical manifestation, it's like a clinical triad in hemochromatosis. Very often it is hereditary, yeah, because of some hereditary enzymopathy. But also it could be acquired. Yeah, therefore there are two kinds of hemochromatosis. Primary, it is hereditary, and secondary. Secondary, it is exactly acquired. Secondary happens in if patient use too much ferrum-containing drugs, for example. Yes, sometimes in women it happens. Women are scared by ferrum deficiency anemia, and they can use too much ferrum-containing drugs, yeah, to prevent this anemia. But for they can have another problem. Yeah. Also, it can happen after part of stomach removal. Yeah. For example, if patient has some tumor in stomach and resection of stomach was done. Yeah. After that, it's in long time food exactly. Yeah. Locates in intestine and excessive absorption can happen. Also in liver diseases, in intestine diseases, also we can expect hemochromatosis development. And the main clinical manifestation of hemochromatosis, this clinical triad, yeah, bronze, because it has like bronze brownish color, yeah, bronze diabetes, because of pancreas injury, bronze cirrhosis because of liver injury, and bronze skin. Three main symptoms. Yeah, bronze diabetes, bronze cirrhosis, and bronze skin. Is it clear?
Yes, doctor, it's clear.
Therefore, tell me, please, like conclusion, what is the main difference between hemosiderosis and hemochromatosis?
Origin, ma'am.
Where the hemocyte movement comes.
Origin.
What exactly?
In hemosiderosis, it is due to hemolysis of RBC, but in
Yeah.
hemochromatosis, it is due to increased absorption of iron in the intestine.
Yeah, excellent. Very nice. Okay. Next, what should we talk about? About hemosiderin. How can we recognize hemosiderin at all? Yeah, hemosiderin. It is what color it has?
Golden yellow.
To brown yellow. Golden to brown yellow.
Golden brown yellow. Yeah, golden brown usually. Yeah, it is exactly. Yeah, and because of hemosiderin accumulation, we can see brown color. Yeah, like a brown color of this organs tissue. It becomes brownish. Yeah. But if you remember, we have talked already about brown atrophy of the heart. Yeah, which pigment is accumulated in brown atrophy of the heart?
Lipofuscin.
Lipofuscin. Lipofuscin is also brown color. Yeah, ferritin is brown. Melanin can be brown. Yeah, there are too much pigment. Therefore, if we can see brown pigment accumulation, yeah, brown pigment exactly, we have to understand which exactly pigment is it, yeah. Therefore, we have to use additional some specific staining, yeah, like we have talked about them in fat dystrophy, yeah. What staining should we use in fat dystrophy? Sudan 3, Sudan 4,
Or osmic acid.
Yeah. What specific staining should we use according to amyloid?
Congo red.
Metachromasia.
Congo red, thiophantinum, yeah, metachromasia.
Iodium sulfate.
Very nice, yeah. Yeah, I have very nice students. Okay, and therefore, according to hemosiderin, we also have to use specific staining. What staining is it?
Prussian blue.
Yeah, Persian blue reaction or Pearl's reaction. Yeah, to name Pearl's reaction or Persian blue reaction. Yeah, Persian blue. This staining has blue color. Therefore, pigment, if we use it, becomes blue color. Is it clear?
Yeah.
If we use Persian blue reaction, yeah, for example, we saw that pigment, brown pigment was accumulated in cells, exactly in tissue, everywhere, yeah. We use Pearl's reaction, and if we can see blue color, therefore, yeah, our conclusion is hemosiderosis, yeah. But if we use Pearl's reaction, but it isn't blue, it has the same brown color, what it is? What can it be?
It can be anything.
Lipofuscin.
Lipofuscin. Yeah, according to lipofuscin, what specific staining should we use to understand that it is exactly lipofuscin?
Ma'am, Sudan.
Yeah, because it contains lipids. Therefore, we have to use a specific osmic acid or Sudan 3. Yeah, is it clear?
Yes, ma'am.
Yes, ma'am.
Yes, very nice. Okay. Next, what should we talk about? But I think that we should be interrupted in any moment. Yeah. Okay.